There are three major statistics I always want women to understand. 1 in 3 women die of heart disease more than all cancers combined. And when you look at it, 80% of the time it is preventable. But here's the crucial fact. 70% of women don't even know that they are sick or at risk for heart disease. So when I really talk about what the big message is, know your risk factors. Know that you can actually prevent heart disease. All you have to do is become educated, become empowered, and become your own best self-advocate. When it comes to women and heart disease, it's not like we really have the roadmap and the algorithm that's as clearly defined as it is for men. So I really just want all women to know that they need to understand who they are in this story so they can get the help that they need. My name is Dr. Suzanne Steinbaum. I am a preventive cardiologist with a specialty in women and heart disease. I've been the director of women and heart health programs in 3 major hospitals in New York and left to go into private practice to really focus on holistic care for women and cardiovascular health. I'm also now the CEO and founder of Adesso, a software solution for women's cardiovascular prevention, health, and wellness. There are 3 major statistics I always want women to understand. 1 in 3 women die of heart disease more than all cancers combined. And when you look at it, 80% of the time it is preventable. But here's the crucial fact. 70% of women don't even know that they are sick or at risk for heart disease. So when I really talk about what the big message is, know your risk factors. Know that you can actually prevent heart disease. All you have to do is become educated, become empowered, and become your own best self-advocate. When it comes to women and heart disease, it's not like we really have the roadmap and the algorithm that's as clearly defined as it is for men. So I really just want all women to know that they need to understand who they are in this story so they can get the help that they need. My name is Dr. Suzanne Steinbaum. I am a preventive cardiologist with a specialty in women and heart disease. I've been the director of women and heart health programs in 3 major hospitals in New York and left to go into private practice to really focus on holistic care for women and cardiovascular health. I'm also now the CEO and founder of Adesso, a software solution for women's cardiovascular prevention, health, and wellness. I always think it's so important that we go back to the history. How did this happen? And it wasn't until 1993 that the Office of Women's Health opened through the NIH. And why this becomes important is it wasn't until that moment that it was determined that research needed to investigate women independently and separately. So all the research before then, it was done on men's hearts and extrapolated to women. We just never, ever had the research for us. And then when you go back in time and look at what's been going on in medical schools, I was never taught that women got heart disease. It was a man's problem. So for decades and decades and decades, the education was not focused on women's hearts. For all the doctors coming out of school, they were not looking at women the same way that they were looking at men. And the last issue comes down to the women. The women never ever think that they're at risk at heart disease. They will think things like, I don't have a family history, or I'm not overweight, or I exercise, or I eat okay. And it becomes a conversation within themselves that they just don't want to believe that it's their problem. It's really interesting. There was this one study that I just love. It was looking at 1,000 women. It was a really small trial, but these were educated women. And the question was, how many women in this room know that heart disease is the number 1 health threat? And in this room, something like 98% of women said, yes, we know. Then the question was, how many of you in this room know or believe that heart disease is your number 1 health threat? And guess what? Only 13% of those women raised their hand. It was everyone else's problem, but it couldn't possibly be my own. And so when you look at this whole big conversation of the research, the doctors, the women themselves, it's the perfect setup for women to be underdiagnosed, undertreated, misdiagnosed, mistreated. And 59% of women, when it comes to cardiovascular disease, has suffered from some form of gaslighting. And that is part of the history of this entire story. When we look at how we determine who is at risk for cardiovascular disease, it's a bigger conversation than, say, if we were going to look for breast cancer. That's easy. We take a picture, it's a test, we got it. Well, the heart, we can't see, we can't feel, we can't touch, so how do we know? And it comes down to the risk factors. When we look at the American Heart Association, they talk about life's essential 8, blood pressure and cholesterol and elevated sugars, elevated weight, so being overweight or obese. Then we look at lifestyle issues like smoking, sedentary lifestyle, poor diet, and actually sleep. So those are the 8 factors. But there are other risk guidelines that tell us what our risks are. And it looks at our risk over a 10-year period for whether or not we're going to have a heart attack. And it becomes important to know this. This is how doctors think. This is how they determine how aggressively they're going to treat you, how they're going to evaluate you, what testing they're going to do. But I have to tell you this scary piece of that story. For these risk analyses, women less than 65 years old have about a 50% chance of not being accurately risk identified. 50% will not be looked at the way they need to be looked at to get the treatment and the prevention they need. That is a critical piece to the story. So now when we talk about women's heart health, when we talk about the big picture of what it means to find health and wellness in cardiovascular disease, we really need to understand what all the risk factors are for women. So I mentioned 8 that are really important for both men and women, but women, it's a little different. We are at risk for heart disease based on who we are holistically. And it starts very early in life. We can go back to our pregnancies. Did we have any adverse outcomes of pregnancies? And that's things like preeclampsia, gestational diabetes, miscarriages, low birth weight babies. Any issue that really made your pregnancy not special and perfect and magical. I just say that in the big context. But all of those things matter and increase the risk. And in fact, when we think about pregnancy, we think about it as the first metabolic and physiologic stress test. And when you have any problems with pregnancies, it tells you that there is some underlying issue with your arteries and that it can lead to heart disease. So that's the first thing. The other thing that becomes important is that things like depression, anxiety, stress, social isolation, these issues that really manifest, let's say in our minds, are so connected to our hearts. There was this really interesting study in 1994, and it looked at the cells on the heart. When this study was done and these cells were analyzed, on the heart, there are similar cells to those that are on the brain. Now, why is that important? Think about that. If we have brain cells in our heart, then we are actually really so triggered by all those negative thoughts that we have in our heads. What we think, how we feel, our perception, are we optimistic? Are we pessimistic? Do we wake up every day dreading life or excited for the day? All of these feelings affect our hearts. And what happens then? These stress hormones develop. And these stress hormones like cortisol cause inflammation, and inflammation is toxic to the vessels, to the arteries. And that all leads to heart disease. And this issue is very important for women. I think we're very heart-centered beings. I always say when men get upset, they get a headache or diarrhea. When women get upset, they get chest pain and palpitations because we feel life and our hearts feel it too. The other issue that we have to think about when it comes to the risk of heart disease and how it manifests in women are diseases that are more often or more common in women, like autoimmune diseases. These are inflammatory processes, things like rheumatoid arthritis, lupus. These happen more often in women than men, and that inflammatory process, the same as I talked about with stress, it is so toxic to the lining of the arteries, and this also can lead to heart disease. So in the big picture, it's not just, do you smoke? Are you eating well? Are you exercising? It's who we are in our lives. And who we are in our lives is really critically important to whether or not we are going to get heart disease. One of the things that is so important to talk about is the family history piece. And the reason I want to separate this is because it's so strange to think about, but it's not part of the risk analyses, which I think is fascinating because we know the importance of family history in whether or not we're going to get heart disease. So I believe it should be part of a standard risk analysis, and over time it might be. But the question needs to be asked, do you have a family history of heart disease, and what is it? Is it high cholesterol? Is it high blood pressure? Is it early coronary artery disease? Because not only does that put you at risk for those issues, but it means that you need to be diagnosed and treated early. It does not mean you're going to get it. 80% of the time, heart disease is preventable. I will say that over and over again. But what I will tell you is that unless it's diagnosed and unless it's prevented, then you're going to end up getting the disease that your family had. And it will have manifestations that are going to be possibly more toxic, more aggressive in you than in someone else because of that genetic predisposition. One of the things that becomes important to understand is that we have the tools now to test for your genetic predisposition. We have the ability to do blood testing, look for things like LP little a, lipoprotein little a, which is actually part of the cholesterol panel. It's a genetic marker, so we can't change it with how we eat and how we exercise. But having an elevated LP little a makes that LDL, that bad cholesterol, really sticky and clot together. And so it's associated with early plaque, early atherosclerosis in the arteries, and early heart disease. If you get that checked early in life and you know you have it, then throughout your life, you know if that bad LDL cholesterol goes up, you need to be treated for it. And that simple shift in mentality and treatment strategy will change your outcomes. The same thing exists for another genetic marker called ApoE. ApoE has been often thought about as a marker important for Alzheimer's disease. It processes and shuttles cholesterol out of the bloodstream. So after you eat and it gets digested and processed, it gets then excreted from the body. So we have the ability now to understand the importance of family history and what to do about it. So don't ignore it and say, it's just my family history. Embrace it and know that you can do something about it.